Good afternoon, everyone. It's 1 o'clock, so we'll make a start. Welcome, everyone, to this interactive workshop to introduce you to our serial prescription toolkit. Just as a reminder, we are recording this session. We've automatically switched everyone's cameras off for now, just to minimize the drain on the bandwidth, so that's why you can't see any faces. Really happy to see so many of you. There are almost 170 of you that have registered for today's session, and we want to extend our thanks to all of you, as we are aware that there's a significant amount of pressure on the frontline teams just now. Really appreciate that you've taken time out of your day to join us. If you have any issues viewing any of the slides, just pop a note into the chat box and one of the team will be up there to resolve it for you. Can I have the next slide, please, Debbie? So we'll start with a quick introduction of everyone who's involved in this session. So my name's Eloise Johnston. I'm the Senior Improvement Advisor who's going to be leading these workshops that will help you implement serial prescriptions in your practices. We're joined today by Graham Gould, who's our GP Clinical Lead, Mark Easton, who's our Clinical Lead, and Adeline Tan, who's the Improvement Advisor in the team. So lots of you will have known Leslie McFarlane, who was the Senior Improvement Advisor leading the Pharmacotherapy Collaborative before and during the pandemic. We've moved on to a new role in our Nursing and AHP Directorate as a Portfolio Lead on Excellence in Care. So it was great news for Leslie, and obviously we're wishing her all the best in her new role. We're also delighted today to be joined by Elaine Payton, Margaret Robertson and Caroline Galt on the workshop. Elaine's a Senior Prescribing Advisor, and Margaret and Caroline are the Chair and Deputy Chair of the National Community Pharmacy eHealth Facilitator Group. And I'm going to hand over to Adeline for the next slide.
Hi. Before I start, I'd like to run through some basic virtual housekeeping to ensure you get the most from this experience. To minimize noise interference and maintain streaming quality during the session, we have muted your microphones and turned your cameras off when listening to the presentation. We will be recording this workshop and it will be posted on our pharmacotherapy website. We will email you to let you know once it is posted. We have set time aside during this session at different points to pause, for you to ask questions and for us to answer. You're invited to interact with us during these pause sessions by raising your virtual hand and unmuting your microphone. We invite you to use the chat box to ask questions throughout the workshop as well, and you should find the chat icon at the top of your screen. We have recorded the Serial Prescription Toolkit webinar and will be publishing it shortly on the Pharmacotherapy website. We'll be adding to the resource from this series of digital workshops, and the update will be available around end January and will be circulated shortly after. If you're experiencing any technical issues, please let us know in the chat box so that we can help you resolve it. Finally, please note that any text in the chat box and any video and verbal communication are recorded and will be published on the Pharmacotherapy website. Next slide, please. The aim of this session is to provide you with a demonstration of the toolkit's functionality, an explanation of how to assess and apply the practical resources within the toolkit, as well as an opportunity to ask questions and share experiences of setting up or reviewing of serial prescription processes. We are discussing step 1 and step 4 today. And wherever you are from, whether you're a GP, a primary care pharmacy, community pharmacy teams, practice managers, admin staff, or any other primary care prescribers, you're very welcome today. Next slide, please. So we'd like to learn a little bit more about you today. If you can pop in the chat box who you are, which part of Scotland you're in, have you joined our Serial Prescription Toolkit webinars in October, as well as any expectations for joining this session today. And while you do that, I'm going to keep talking. And it's really nice if you can see from the heat map where everybody joined us during our introductory webinars in October. So I'm going to hand you over to Eloise now.
Thanks, Adeline. If I can have the next slide, please. So just want to pause really briefly here to try and describe the atmosphere that we're hoping to create for today's workshop. So as improvers, we know that someone in the room usually has the answer, and our role today is to provide that opportunity for you to ask the questions that will help you plan and implement serial prescriptions. So this is the first of a series of 4 workshops over the next 2 weeks, and the focus today is very much on that planning and preparation stage. We're going to take you through the toolkit to show you much more of the detail than we covered in the webinar. Although we won't have time to open every individual document, we're going to explain how the toolkit's structured, and we'll highlight all of the individual resources that are included within it for you to go away and have a look at. Next slide, please. So I thought this is a helpful document to highlight from the Scottish Government website about information for patients in terms of the Medicines Care and Review Service, and obviously serial prescriptions sit within that service. The serial prescriptions are where we see pharmacies working with GP practices to help people get their medicines at the best time. If people are prescribed regular repeat medicines, they may be able to have a serial prescription if their prescriber thinks it's suitable. Serial prescriptions can be issued for various periods of time, up to 56 weeks, and kept by the community pharmacist, who then dispenses it in regular intervals as prescribed. So this basically means people can get their repeat medicines direct from the pharmacy without necessarily having to order that monthly or 2 monthly prescription from the doctor beforehand. So when you're transferring patients to serial prescriptions, it's really important to test the processes to ensure that they're safe and that they improve quality for the practice teams and the patients. So using serial prescriptions can be more convenient for patients. It can reduce that unnecessary footfall and some of those phone calls to the practice, can potentially reduce some of the prescribing associated workload within the practice, and it can support community pharmacy teams in coordinating and managing their workload. Next slide, please. We initially started work on the Pharmacotherapy Collaborative at the end of 2019, and when we remobilised after the first lockdown, the feedback we were hearing from the teams was that a focus on implementing serial prescriptions would be most useful to the practice teams. So between November 2020 and March 2021, we worked with 53 GP practices across 8 health and social care partnerships in Scotland to develop and test new and existing practical guidance and resources. The resulting toolkit you see on the screen is a combination of national and co-produced iHub and local resources. We're delighted to have had the toolkit endorsed by the RPF, and we're currently working through that endorsement process with RCGP. So the toolkit was created as an interactive PDF, and it's designed as a cycle of 5 key steps. So planning, which is what we're covering today, selecting your patients, setting up your serial prescription processes, discussing serial prescriptions with your patients, which we're also covering today, and then dispensing. So at the centre of this implementation are the quality improvement tools that support the processes. And it won't come as a surprise that GP practices will all have varied serial prescription processes and experiences. So you can click directly on the icon that you want to review, and the toolkit consists of 9 slides in total. You can scroll through, or you can click on any of the icons highlighted in red, which take you directly to a specific page with a range of resources.
Sorry, what was that?
Next slide, please. So this is what the page of resources for each step looks like. And so here we've used the setting up a serial prescription page just as an example for you to see the structure. So the page is divided into purpose and resources. In each purpose, there are some resources which have been categorized into guidance, tools, and training, and each resource has an icon to denote its category. The resource in bold text denotes a key document, and some steps also have sections on good practice resources. So Debbie, if you can just click through the animation there, the red boxes will work through a sequence to highlight all the things I've just described. So the last one that's highlighted there is the home icon. At any point in the document, if you want to return to the front page, that's the one you click on. So at this point, I'm going to hand over to Dr. Graham Gould who's going to begin to take us through the documents, the resources that will support you in the planning stage of implementing serial prescriptions. Thanks, Graham.
Thanks. Thanks very much, Eloise, and thanks to everyone who's attending today. So we have planning today, and if you miss anything, it's all going to be available on the toolkit on the iHub, and we've also recorded our previous webinar that covers all the stages. So the first point in step 1 of planning is to consider the awareness and training for serial prescriptions amongst professionals. Awareness and understanding of the process of serial prescriptions is fundamental to delivering improved outcomes for your patients, the GP practice, and the community pharmacy. As a practice team, you must be ready to implement the changes that might occur with regard to culture, resource, staffing, and training. Also, understanding how others have managed serial prescriptions can be enlightening, as you may have concerns that others have already overcome. Key documents were chosen after much team discussion as vital to the planning stage indicated. And here we have an example of the benefits and tips for serial prescribing. This will be particularly useful for practices that are just starting on their journey, and it's a key document to provide an overview of the process and create awareness amongst your team. Use this document as a tool to promote the benefits of serial prescriptions to your team, and have a look at the tips, because a lot of these tips are exactly what our GPs and practices have been feeding back to us as being successful. Next slide, please. Another key national document vital to the planning stage is to consider the journey of a serial prescription. So the journey of a serial prescription is a process map for helping your teams walk through the current process to identify any gaps. During this series of 4 workshops, we'll be working on an expanded version of this document to include links to additional information and support. And one example of this is the training of staff, how to contact your facilitator and review clinical suppliers' learning zones. Next slide, please. Here we can see how to further promote the benefits of serial prescriptions. And it's a short 8-minute video on the introduction to serial prescriptions for both GPs and practice staff. And this is where you can hear from frontline staff working in primary care. Next slide, please. We're aware that some practices are using Vision and others EMIS, and we've highlighted here the administrative housekeeping guidance for Vision. So it can help document what practices are doing and how to do it. And this was produced in partnership with NHS Grampian. We have now received an EMIS equivalent document, kindly shared by Margaret and Caroline, who are on the workshop today. And this will be added to the toolkit once we have completed all 4 workshops. Next slide, please. As part of the training resources, we have the SEGIDIM Serial Prescribing Overview for Vision Practices. And this might help your team move forward at pace. And some of you will already be aware of the SEGIDIM training videos for other aspects of Vision. Next slide, please. So from Greater Glasgow and Clyde, we'd like to express our thanks for their flowchart, which helps you look at Medicines Care and Review, or the MCR process. And this is for EMIS practices. This document's available in the guidance section. And this is a local example. The templates are only available within NHS Greater Glasgow and Clyde. And that brings me back to the toolkit where, as Eloise indicated and the short interactive slide showed, there are both local and national examples of resources. And on some parts, there are good practice tips as well. Next slide, please. Greater Glasgow and Clyde have also provided a case study for serial prescribing, and this is an in-depth look into the work that Greater Glasgow and Clyde had done during the pandemic to help provide much more in the way of serial prescriptions for practices, pharmacies and patients. And this again provides useful tips and hints to your practice when implementing serial prescribing. So at this stage, we're going to have a look at the questions in the chat box and take a moment to pause and answer any questions.
We don't have any questions that come out in the chat box so far. But at this point, does anybody who would like to ask a question, feel free to use the raise hand function, unmute your microphone and ask any questions.
Don't worry if you're feeling shy at this stage. We can pick up any questions you leave in the chat box after the event, and we do have other pause and ask points throughout the presentation today, and we're happy to answer any emails that come in.
We have got one question now. What is the best way to identify patients who are suitable for serial prescribing?
Thanks, Adeline. Yes, thanks to Ailey for that. There are resources within the toolkit for that, Ailey. There are various ways of identifying patients who are suitable for serial prescribing, and quite often when you're starting out, we recommend looking at the easy hits in the first instance. So looking at patients, for example, that are on simple medication regimes, such as levothyroxine, or one or two items that don't involve too much in the way of screening out other medications. So there is a list of criteria that you can use for identifying patients who are suitable for serial prescribing and who fit those criteria and who don't. So for example, people that are on immunosuppressive drugs and people who are on opiate drugs will not be suitable for serial prescribing. So we have another, I can see the questions, Adeline, so we'll just answer the one about the admin team from Emma Gallagher. The admin team are absolutely crucial to serial prescribing. Hopefully within the admin team, you'll have members that might be interested in learning more about serial prescribing. And we do suggest that if possible, somebody becomes a champion within that to help promote serial prescribing within the admin team. But promoting serial prescribing to patients, looking for suitable patients can also be done by the admin team, and also just participating in the whole pharmacotherapy side within the team there and communicating between the pharmacotherapy team and the prescribers. So it's crucial to have the admin team involved. And thanks to Lane for suggesting STEW as a way of looking for patients that are suitable for serial prescribing. Shall we move on?
I think we can.
Yeah. So we're going to continue to work through the planning. The next point in step 1 is to consider the readiness of your team for implementing serial prescribing. And we have a readiness checklist for serial prescribing as a key document to support your assessment processes. And if you have a look at the document at your leisure, you'll find that we have red, amber and green sections. And the majority of the red items can be completed by either eHealth or their colleagues, depending on your situation in your health board. And the shared care agreement that we also have as a document in the Readiness can be used to help define the roles between community pharmacy and the practice. And that needs to be in place, ideally prior to initiating serial prescription. And this will help your process mapping and producing protocols within the practice for serial prescription. Next slide, please. We have training checklists for both Vision and EMIS. And again, these are two key documents that your team will need when you're assessing their overall team requirements regarding culture, systems, staffing, and training. Next slide, please. Another way of helping your assessment process within the practice is to have a look through the frequently asked questions. And this will help you assess where your team needs further support or education. Next slide, please. So this is something that I've used myself. I've recently retired from general practice, but prior to that, it was really useful last winter to look at the estimated maximum inhaler usage document guidance or guidance document that was produced and developed by NHS Greater Glasgow and Clyde. And this is a practical example of serial prescribing for a specific medication. And when my own practice started doing serial prescribing, and CMS as it was known in the beginning, our practice pharmacists specialised in asthma management, and we actually had a lot of patients that were on inhalers put on to serial prescribing in the very first stage. And that was successful because of the communication process, the assessment process, and the communication between the practice pharmacist and both the patients and the pharmacy. So we now have time for some more questions from the chat box. Anything to report, Adeline, because I haven't been monitoring the last few minutes?
No questions so far for this section.
Yeah, I mean, it's a good point from Eloise that when we're doing workshop 2, there'll be far more detail around patient selection and the criteria for doing that. So we're not going to feature that today.
No questions has come in, Graham.
Okay, so let's move on, please. Next slide. The next stage in planning is to agree a process for implementing serial prescribing. A smooth implementation of serial prescribing involves clear communication across all parties involved. Those involved within the GP practice must understand their roles and responsibilities. And to facilitate this, we have two quick guides, one for general practice and one for community pharmacy. And these were developed by eHealth facilitators and could be useful to review these at the readiness stage. Next slide, please. So here we show the guidance specifically for community pharmacy. Next slide, please. So to further help your implementation, it's good to get an agreement developed as a partnership between the GP multidisciplinary team and the community pharmacy teams. This will help a collaborative approach to discussing the parameters which will form the foundation of your serial prescription service. This could be across a one-to-one or one-to-multiple GP community pharmacy teams. And this is a useful tool for developing a serial prescription standard operating procedure. We're well aware that, for example, city practices across Scotland will have multiple community pharmacies attached to them and not have the luxury of dealing and communicating directly with one practice. It's important to note here that the shared care agreement doesn't directly involve the patient. However, it does allow for agreement of a patient communications strategy. Next slide, please. Here we've included a locally developed MCR shared care agreement, which was developed by NHS Grampian, and you may already have your own local example which would fit better with your own practice and health board area. Next slide, please. And here we're showing the discussion points for the joint working agreement that was developed by NHS Grampian, and this is another local document in the toolkit. Okay, so we now have time to address any further questions before we move on to Mark.
So again, no questions has come in through the chat box, but I'm just wondering if there's anybody who would want to ask a question. If you just use the raise hand function and unmute your mic to ask any questions.
I didn't think I was that scary, Adeline, but obviously, you know, that's what's happened.
So we can move on to Mark and covering information, informing patients. But if there's any other questions that pop up, just feel free to pop in the chat box. Oh, we've got one question, one hands up from Elizabeth.
Hi, sorry, it's Matthew Williams here. Hi, GP. I was just wondering if we start someone on one of these serial prescribing and then the medication changes halfway through the year, what happens to the rest of that year's prescription and how do we manage that?
The rest of the year's prescription would continue. If you're stopping or changing a medication that's already on serial prescription, then that would be taken off serial prescription and you can do a new serial prescription, either of a new drug or a new dose of the existing drug. At that stage, it's crucial to inform the community pharmacy what you're doing just for safety purposes, but they will then coordinate the new serial prescription and synchronize that with the existing serial prescriptions. So once it's done, it'll hopefully smoothly go back into the process of serial prescriptions being either 6 months or a year before they're reviewed.
Okay, thanks.
Got another hand up from Antonia.
Hi there, it's just to follow up on the question before. So you said if, say, part of the prescription was cancelled, or say one of the items was cancelled, and that whole prescription was 56 weeks. If that was only, say, a couple of weeks in, how would that work if the kind of serial prescription is only 24 weeks, 56 or 48? What if the new item has to be sent in, say, for, 40, I don't know, 42 weeks or something like that? How would that work?
Yeah, so we were struggling a little to hear what you were saying there, Antonia, but yeah, the community pharmacy will be able to synchronize the prescriptions. They will be well aware of people already not using full amounts of prescriptions and monitoring that when they have time to speak to them when they come in, and they can also synchronize a new prescription. So even though it's starting within the, as you said, the 48 or 56 or 52 or 56 week prescription, it can be synchronized by the community pharmacy.
Yeah, great. I'll maybe just come in here just to support that. Sorry, this is Mark, and my main function is as a community pharmacist. So yeah, just to give you a little bit of reassurance on that, if there have to be changes to a prescribed serial item, then the only method for doing that is to cancel the existing item and replace it with a new prescription. Now, that, as you've just alluded to, can give us things that appear to be out of sync. So the time for that to be reconciled would be at the end of the prescriptions, where a TSR, a treatment summary report, is sent by the community pharmacy. And best practice would suggest that we would complete the treatment summary for all the items at that point, even if one of the items hadn't been completed. So you may still have dispensing options on that, but to bring them all in line at the end of the life of the main bulk of the prescriptions would be good practice, and the process of supplying the TSRs at that point with some clinical input would support that. Just to say that we will cover that off in a lot more detail in one of the future webinars. So again, great that people are thinking this through at this stage in the planning. So please join one of our additional webinars for a bit more detail on those, and hopefully that'll be useful.
Thanks, Mark. And also, if you have a look in the chat box, folks, you'll see that there's more reassurance around how the cancellation message is transmitted and having to produce a new prescription when you're starting a new medication. And Mark's entirely right about summarising everything at the end of the prescribing period with a treatment summary report. And we do have a workshop featuring that step or stage in the toolkit.
We had a hand up from Marie, but the hand's been down, so I'm not sure if you still want to ask a question. No? Okay, we can move on.
Okay, so yeah, thanks for that, Graham. In terms of the detailed slides on the planning, we now want to spend a little bit of time looking at how we inform our patients. So this is step 4 in the process, and we'd like to think today particularly about your communications with patients in relation to your planning. So communication is a key part of what we will be looking at across all 4 of these workshops, simply because the communication is not a one-point item. Communication is key throughout this process. So today we want to think in terms of communication at the planning stage when you're thinking about moving patients onto zero prescriptions. So this is about letting the patients know within the practice that they're going to move on to zero prescriptions. Now, as good practice around communication, when you're undertaking a large-scale move to zero prescriptions, you should consider this at an early stage. So consider how to discuss this with your patients and inform the patients of the changes. Now, you know your patients better than anyone, so thinking about their needs and thinking about which points of the patient flow they should have communication is going to be key. So what are the specific communications they're going to need, whether that be verbal, written, or electronic? Next slide, please. The first point to look at is having a person-centered discussion with your patients. Now, it's important that our discussions with the patients are person-centered, as there's a lot of process involved in this. So there's a potential to frame our discussions as a process-centered conversation. But the key element to this discussion should be about how we can support patients and how we can explain the benefits to them. Clear and effective communication with the patient is going to be key to an efficient transfer from repeat to zero prescribing. And I would encourage everyone to think about how they're going to communicate their part of the process with their own patients. So, for example, practices will have one conversation with the patient community pharmacies will have a completely different conversation with the patient, simply because they're coming at this from different perspectives, and the community pharmacy will have their own ways of managing the prescriptions. So talk about what you're doing in terms of supporting the patients, and leave other people to talk about what they're doing, because actually they will know best. So the document we've highlighted here is the questions to prompt a person-centered discussion. And this is one of our key documents from the toolkit, and it's to help around those initial discussions, but also the review stages, particularly the first reviews. This can be a particularly helpful document. And again, just want to reinforce, this is not something that you use once. This is something that you can use at several stages in the process, depending on the specific purpose of your communication. Next slide, please. We've also included a person-centered discussion checklist, and this is one of our other key documents, particularly useful in terms of framing your initial discussions. So have a look at this one. Again, it's in the toolkit, and we've included on this one a link to some video. So you can either use the QR code if you're very tech savvy, or there are links included in the toolkit that take you direct to these videos, which can be hopefully quite useful and informative. And we can take any questions around that at this stage, if anyone has any questions.
So no questions has come in the chat box around informing patients.
Okay, again, as Graham alluded to earlier, there's plenty of space for asking questions within the chat box if you'd rather do it that way at a later date as we cover things off, or emailing into the team. We're happy to support and respond to any questions. So if there's nothing coming through, we'll move on to the next slide. So we also want to think about what written communication you're supplying to your patients. And again, written communication can be really helpful in terms of supporting any verbal communications you've had with the patient. So we've provided here a patient information letter or leaflet, and this helps to frame your communication around the basic changes in the system. The written communication also offers some reassurance around the areas of their care which are unchanged, but which may be of concern to them, such as their ability to see the GP. So patients will often ask, well, if I've got this long-term prescription, does that mean that I then can't go and see my GP about my medication? Of course, the answer is absolutely not. They've still got all the same access to the GPs that they always have. So that written communication can be very reassuring within that, that discussion. Next slide, please. So whilst the key document we have is the national document, we also have an example here of a locally developed letter. So this was a patient information letter that was developed by Kirriemuir Medical Practice in NHS Tayside, and that can just help to point you in the right direction in terms of seeing how other people are doing things, and help with your own conversations at the planning stage as to what levels of communication you're going to need and the tone of that communication. Next slide, please. We've got another example here, again, within the locally developed support within the toolkit. And this is one from NHS Highland. Again, a locally developed patient information letter. So have a look at those and take the good points from it that are relevant to your own practice. And because, as I've already said, you know your own patients better than anyone. So a range of resources there, and hopefully those can be of value at your planning stage. And do we have any more questions at this stage?
So no questions as such, but just to highlight that Margaret has said to use the shared care agreement to document your patient communication strategy. And Caroline suggested that in NHS Grampian, a patient leaflet should be added to the front of the patient's first set of serial prescriptions. And Hillary said that practice pharmacists in some areas could be involved in identifying suitable patients for serial prescription.
That's great. So really good to have the expert support on the call today. So keep an eye on the chat because there's stuff coming through there. And these are people who have been at the very top of developing the e-pharmacy strategy and the work around serial prescriptions. So great to have that support here. So if there's nothing else, maybe we'll just move to the next slide.
Okay, thanks, Mark. So the toolkit obviously is a resource, and we know that just producing a toolkit by itself isn't going to magically resolve all of the detail around how you're going to implement this within your practice. So it's there to help your practice implement serial prescribing by giving you that kind of guidance, the good practice, and the experience and the insight from the teams who've actually put this in place over a number of years. And how each practice is going to use the toolkit will probably be different, but it's about thinking of those kind of core principles around planning and testing and just ensuring that you're communicating with everyone who needs to be informed. So it's really at the planning stage, taking time to think about how you build serial prescriptions into your daily practice processes and doing that in a way that's manageable and therefore sustainable. So just as one simple example, looking to stagger the serial prescriptions for patients, for example, by their birthday month, so that when the time comes for medication reviews, you're not going to be reviewing a significant number of scripts all at the same time. So it's trying to, take this time at the planning stage so that you can figure out what your sort of measured, balanced approach is going to be around making sure that that workload doesn't come at you in huge waves. And hopefully this is going to help ensure that it's a sustainable change in terms of the way that you manage the prescribing workload in your practice. I'm just going to hand over briefly to Adeline, who's going to cover the QI tools.
So there is a suite of QI tools that you can freely access to support implementing serial prescriptions in your practice. We've only highlighted some of the tools today. A driver diagram visually presents a team's theory of how an improvement goal will be achieved. A process map helps the team visualize a serial prescribing process. PDSA stands for Plan, Do, Study, and Act. And PDSA cycles are an ideal QI tool that can be used to test an idea by temporarily trialing a change and assessing its impact. A data measurement plan sets out details for each measure proposed for the improvement project, and the data collection template helps you to collect appropriate data for informing your work. We have posted the link to the NEST QI zone where you can access more information on how to use the QI tools shown here. You also have your local QI support team. These specialists can help you understand these QI tools more in depth. The other local specialists you may be able to call on is your local e-health facilitators, and they can also support your implementation of serial prescription toolkit. I'll hand you over to Eloise now.
Can I have the next slide? Thank you. So we are almost pretty much out of time, and we seem to have managed to get through the slides, which is wonderful. In terms of wrapping up the session, we'll pop the email address for our team into the chat box. So if there are any follow-up queries or suggestions you have, please get in touch, and we'd be really pleased to hear from you. We know everyone's busy, but we would really like to hear how you found today's session. And we've drawn up a very short 4-question feedback survey. And obviously, these always help us improve future workshops and webinars. So we appreciate your honesty if you can take a minute to complete that. The link will be dropping into the chat box. All the responses are anonymous, so you can be as open as you wish. Feedback is a gift. We take it as such, and we're grateful for you spending the time to fill those in. And once you've completed that survey, please feel free to log off. So in the meantime, it just remains for me to thank every one of you for your time today attending this workshop. We'd like to send our best wishes to you all in setting up your serial prescription services, and please keep in touch, let us know how you get on. And also I'd like to say a huge thank you to our presenters today, to our chat box gurus who've been responding to all the queries immediately, and I suppose most of all to our behind the scenes production team who've all been working phenomenally hard to keep all the tech running to let us share these insights with you today. So thanks again everyone, and feel free to log off when you've done the survey.